So this question is for Dr. Clear. Can you tell us about the common viruses that are prevalent during the winter months?
Sure, Deanna. One of the most common viruses prevalent during the winter months is the flu virus or influenza virus. Actually, this year the CDC recently stated that it's at epidemic levels across the country, but most individuals are not aware of another virus that we see this time of year called respiratory syncytial virus or RSV. It actually can cause about 8 to 10 more deaths per year than the flu virus and can be responsible for about 125,000 hospitalizations per year.
Okay. All right, and moving on. This question's for Lindsay. You've had a recent personal experience with RSV, so can you share your story with us?
I can. Unfortunately, both of my children did contract RSV at a very young age. My son, who is now 4, when he was 4 months, we did go and see Dr. Clear, who was our pediatrician at the time, and she recommended with my son having difficulty breathing and his cough that we take him to the emergency room where he did test positive for RSV. And then unfortunately, again, a couple of months ago, I now have a 12-month-old who was 8 months at that time he contracted RSV. He was admitted to the hospital for 3 days and was on oxygen and was on nebulizer treatments and steroids. And unfortunately, both of my boys still do need to use their nebulizers and inhalers when they get the coughing and the wheezing with the congestion as well.
Wow. Okay. Inhalers. Okay. All right. And this question is for Dr. Clear. How can parents be on the lookout for dangers such as RSV and other viruses? And what items should parents have on their healthy checklist this time of year?
Well, parents need to make sure that they are keeping in close contact with their pediatrician. They need to make sure they're keeping up with the routine well visits and checkups that their pediatricians recommend. RSV can cause very common cold-like symptoms, but more importantly, it can cause very severe respiratory symptoms. So they need to be on the lookout for those symptoms as well. They include wheezing, as Lindsay mentioned, trouble breathing, gasping for air. The child can be very lethargic or tired. The child can have a fever. They can also have a bluish color around their mouth or fingernails. So obviously, if the child has any of these symptoms, they should seek medical attention immediately. Since there's no treatment for RSV, it is, like I said, important to be on the lookout for these symptoms. And if parents should also be in contact with their pediatrician so that they can keep up with the recommended vaccines this time of year, especially the flu vaccine.
Okay. All right. Writing this down. Okay. All right. So next question is for Lindsay. What advice do you have for parents looking to help prevent the spread of seasonal illness and RSV?
One of the biggest preventative tips that I can think of is cleanliness. You want to make sure everything is clean that has to do with your children. So bottles, pacifiers, toys, sheets, bedding, anything that you can think of that is going to come in contact with your child, make sure it's clean. You want to make sure everyone washes their hands before they touch your children. And also, if your child's sick, you don't want to send them to school or daycare. You want to try to keep them home with you as much as possible so they're not spreading germs to other children and they're not contracting any other viruses or getting any germs as well.
Okay. Great. All right. Last question, and this is for Dr. Clear or and Lindsay. Where can we get more information about this?
Well, obviously, parents, as I mentioned, should always keep in close contact with their pediatrician for more information. But a really great website that has a lot of great information is rsvprotection.com.
Okay. rsvprotection.com. Okay. All right, Lindsay or Dr. Clear, is there anybody that wants to add to that?
No, I think Dr. Clear, what she mentioned with following up with the pediatrician, that's probably one of the best things that you can do. They're there to answer any questions that you have. So always feel free to call your pediatrician if you have any concerns about your children.
Okay. All right, great. And that's it. Thank you guys both for your time and for this interview. And I wish you both the best of luck with everything. Thank you so much.
Thank you.
Thanks, Deanna.
All right, bye-bye.
Bye-bye.